Welcome back to CLE Weekend. You know, we all want the best health care for those older adults in our life. Excellent primary care. That is exactly what you're going to get here at Archwell Health. I am with Dr. Goddard. Good morning to you.
Good morning.
Okay, so tell us a little bit about Archwell Health.
So Archwell Health is a company that specializes in providing primary care for seniors. We've opened up centers throughout the country, and recently we're in the Cleveland market. We've opened up 9 centers throughout the Cleveland area.
There are 9 here?
Yeah.
So I've driven down the road, like on the east side I was like, there's an Archwell Health. We're here actually in Parma today. The one thing I noticed when I walked in is how pristine it is. I mean, it is so clean and inviting and bright.
Yeah, no, they're beautiful offices, and all of them look alike. They're all built on the same template. And if you'll notice in the entry, there's a big community center. We love that area. It's for all of our seniors to come in if they want to learn how to dance, cooking lessons, lectures. If you're lonely, you just want to come out and hang out in our lobby, so okay. In our community center.
That is the coolest thing. And oh, by the way, yes, I grabbed one of these. This is actually, you know, for the activity room and everything you have going on. And I just thought, what a special place, like a good gathering space, and also to get a lot of our seniors' minds going.
You know, one of the biggest issues for seniors can be loneliness, and that can be just as bad as smoking a pack of cigarettes a day. So if you're lonely, you're feeling down, that affects your health. So we welcome people to come hang out in the community center, come talk to us. If they're feeling lonely, having a bad day, come down and hang out with us.
I like that. You know, as we kind of approach the end of the year, we're thinking about maybe health goals for 2026. What's the most important thing we should be thinking about?
Well, right now, you want to make sure that you have a doctor and a care team that you feel comfortable with, a group that you feel like is taking care of you, they're in contact with you, and you feel comfortable going to and can take care of your needs. That's probably the number one issue.
When we think about preventative screenings and the importance of that, I mean, that's a big deal.
You know, it is. As we're getting older, you know, we start to have more and more illnesses creep up on us. I personally understand this now better than when I was a younger doctor. And so you want to catch those early on. So diabetes, heart conditions, high blood pressure, lung disease, you want to get on top of those early. So one of the things we do in our centers is we do a lot of preventive health screenings to try and catch these early on so we can make a difference.
How can older adults switch to Archwell Health, a doctor here, during Medicare's open enrollment period?
Probably the easiest way is to go to archwellhealth.com. You'll find all of our information as well as our team that'll help set you up with the right insurance plan as well as one of our doctors if you're interested in that. Or you can stop by any of our centers, walk in, and they'll take care of you immediately.
When you come into Archwell Health, do we have to have an appointment? Can we just come in? How does that process go?
No, great question. So we do have appointments, and our doctors see way less patients than a typical doctor in a regular practice. And we have phenomenal doctors in Cleveland, so it's not a negative against them. But our doctors spend more time. We have longer appointments, and they take care of less patients. So we're pretty available almost every day. But we also offer same-day sick visits. So if you call in sick, we actually get you in right away and make sure you're taken care of. Our whole goal is to keep you out of the hospital and healthy.
What is unique is some of these older adults who come in, you take your time, and I know, no offense, Mom and Dad, but the patience sometimes, you know, is just getting a little bit thinner as you get older. But you don't rush anyone. You take time.
Yeah. Well, it's funny because I'm 62 and I notice that I talk way more at the doctor's office, so it must be just with age. But what I will say though is our longer appointments allow seniors to talk more, and we encourage it. We actually want, you know, we tell all of our doctors, don't say anything the first minute or two, just sit and listen because we want to know what's on their mind. So the idea about the longer visit is to get more information out of our seniors, but also to help coordinate care. So if they have a problem with something, we have the time we need to go ahead and arrange the right follow-up or medications, whatever.
And I know sometimes too it can be frustrating when you go to see a doctor and then they're like, yep, just check everything on your phone, online. And it's like, okay, I don't have a computer, or the technology just, it doesn't hit like it does with someone who's younger.
Yeah, and what we find is that there's a certain segment of our population that need a personal touch. They need a phone call, letter, whatever that is, and we take care of that. Then there's another segment as we age in that wants the app, that wants the texting. So we're trying to accommodate both groups.
Yeah. You know, at Archwell Health, what do you guys do to make sure that the seniors kind of stay on track with health? Because it's something that we want to make sure everyone is on track.
No, for sure. So we see people probably more frequently. So our patients are seen either monthly, every 2 months, 3 months. We actually call you on a regular basis. We actually keep a list of knowing what you need done for preventive health. So we're very interactive with our patients. We're in contact all the time. And we make it easy for you to come on in. We also have transportation available too for patients that come in to see us.
Now that's a big deal.
Yeah, it can help a lot. Well, normally our offices are in center areas where it's easy for seniors to get in. where they shop and do other things. But still, if you need a ride, we can arrange that too.
Well, and you talk about, and I'm thinking as you're saying this, seniors being lonely and how that's a big problem. And when you're saying you call and check up, just that phone call, I'm not a senior, but even for me, I think, gosh, I love when a doctor calls to say, hey, I'm just checking up to see how you're doing. It makes someone feel really good.
Yeah, so sometimes our doctors will put them on the schedule to call that patient just to check in on them. Sometimes our care team, we have a large care team. We have nurses, social workers, case managers. Seniors tend to have more complex issues, and so we have a larger team here that helps take care of them.
So if someone is watching at home right now who is a senior, an older adult, or maybe someone like me who's like, okay, my parents, grandparents, is there an option for us to come in and check out the facility?
Oh yeah, for sure. You can come anytime you want. Come in, they'll arrange a tour. You can just stop in and someone will give you a tour of the facility. We have a sales team that'll help as well. And also families are invited. I can't say enough about if you're a son or a daughter and your mom or dad's at that age, you want to bring them, come on with them down. We actually like sons, daughters, caregivers to be involved in the care. So,
and that's what I was going to say. The caregivers, those are the people, and you kind of want to continue on this journey and check up and make sure. So I love that you have that option. So we can just stop in for that. But if we want to look at the locations, hours, what is the best place to go to do that?
Yeah, probably the best place is archwellhealth.com, which will give you phone numbers and all of our sites as well. And you can also just stop by one of our sites and we'll take care of you as well.
Dr. Goddard, thank you so much. This was great to chat with you. And I hope you who are sitting at home really learned a lot about Archwell Health and how beneficial it is to have you here in our community.
Thank you for having me.
Absolutely. Thank you. We'll be right back on CLE Weekend.